Hey everybody, it's Alan and Darlene back with the Health and Wellness channel with
Nurse Darlene.
Nurse Darlene. There you go.
Hi everybody, how are you doing?
Hope everybody's doing well and tackling the COVID-19. We're in the Phoenix Metroplex or metro area, Arizona, and we're starting to see a little bit of a rise. Some of the stuff that you've seen at work and. Unfortunately, we're probably not out of the woods yet. So this episode is going to be really kind of talking about the current COVID-19 as of, today, and kind of what we're seeing. And we're going to talk a lot about how to navigate, ERs, when to go in, when not to go in. And we're going to provide you some really good information, a couple good links as well. So Darlene, tell us, you're in the ER.
Mm-hmm.
She's dressed and ready to go to work today, so she's going to be spending time in the ER.
Yeah.
Tell us a little bit about your environment, how things are kind of set up and what's kind of going on.
So right now we're seeing more than we have been seeing in the last week or two. So we've pretty much tripled, I think, the amount of patients. There's a few reasons probably for that, but I've noticed that a lot of these patients are going home. And so the environment is a lot fuller, but they're not being admitted, which is a good thing, meaning that their condition is not bad enough to warrant an admission.
So talk a little bit about who's high risk, who needs to be concerned, that type of thing.
So in the cases, anybody who has a fever that's continuous and shortness of breath where they can't catch their breath really should go in. The fever, that's the way our body fights infection. So don't just because you have a fever go into the ER, because then you're going to be exposed to all the other things that are going on in there. Okay, so I would say shortness of breath where you can't catch your breath and chest pain that is not getting better.
And then anything to do with a certain temperature or?
Well, temperature 100.4 or higher, that's when you need to start taking your temperature every day at home. Once it gets to 102, that's when you probably should think about going in based on your other symptoms. If that's your only symptom, then no. You can fight a fever at home. Okay, so if you have chest pain, shortness of breath, but you always need to call your doctor. Remember, I'm not the doctor, I'm just giving you information. So call your doctor, ask your doctor what they think that you should do, okay? But most importantly, keep a log of your temperatures, your symptoms. The doctor cannot read your mind. So the most important thing is giving information to the doctor.
That's good advice. Right now, are the same people at risk? Is it the elderly? Is it, those that have?
Yeah, I apologize. That was the question that you asked a minute ago. But you want to protect your elderly and your people who have autoimmune disorders. So whenever you're around them, wear a mask. But yes, if those patients do end up with 2 of the symptoms or more of the COVID virus, then you do need to go into the ER, okay? Because it can get bad quickly for some of those who have asthma, who have COPD, who have congestive heart failure, elderly, and children are actually one of the very resilient. But if they have asthma, then you don't want to take that lightly either. So.
Yeah. So what are some things that we should do now? Things are starting to open up here in Arizona. We were even talking the other day about going back to the movies, and that's going to start to happen. We don't know if that's going to be the case, but before there were certain precautions. Mm-hmm. Now, with things starting to open up, what are some of the precautions? What are the same precautions, or is there anything new? Should we be wearing a mask? Things like that.
So all of you guys know this is the novel virus, so that means it is new. It is new to all of us. It is new to the CDC. It is new to the world. So what we need to do is protect ourselves and protect the elderly, the sick, the autoimmune, everybody who has, other comorbidities. Okay, so that means wear a mask. You need to do social distancing. I don't care if we're opening back up in all the states in different areas. we still need to social distance. And I have to admit that I was one of the ones who was a little leery about that. But seeing the rise already, we need to social distance. Wearing your mask is not going to protect you 100% from the virus, because we all know those are very small particulates. But if I cough and I have a mask on, my droplets are not going to end up in the mouth of that elderly person that's waiting in line at Walmart. So you keep your mask on, and you will protect those around you, and you will protect yourself. I'm going to go back to that fact that it's not going to be 100% protection. We all know that. These particulates are very, very small. It's like putting up a chain link fence to prevent flies from coming into your yard. That's pretty much the same thing. But some protection is better than none. Okay?
Okay. So what's the, is there anything more important that we should be focusing on today? I know you talked about, protecting yourself. Is there anything that we don't know? Like we talked about masks, we talked about kind of social distancing. With social distancing, how do you feel with things starting to open up and this rise? What's your thoughts? What are you hearing from the hospital? What are you hearing from the other doctors?
Well, they're saying that there are certain things that people are doing that they're believing they're protecting themselves, and they're not. If you wear gloves and you are walking around Walmart and you're touching things and then touching your face and touching things and touching your face, you are going to put other people at risk, okay? Because when you touch your face and then you touch that chicken, you are actually going to spread that virus to the next person who touches that chicken. Okay, so we have to be careful about thinking that we're protecting ourselves when we truly are not. We're protecting maybe our hands, but nothing else on our body when you wear gloves. Okay, so make sure that you don't wear gloves to the grocery store, that instead you wash your hands. Okay, hand washing is going to be our number one defense with this. I understand that it's a little bit difficult to wash your hands when you're in the grocery store, but right when you get outside, maybe you can have the hand sanitizer in your car. Put your hand sanitizers on your hand before you start driving, because then you don't have it on your steering wheel, okay? Right when you get home, wash. Or you can go to the bathroom if you're concerned that you touched something that wasn't appropriate. But do not put your hands near your face. Eyes, nose, mouth. Do not put your hands in any of those areas until you wash them, okay?
So, mask. You talked a little bit about mask. Should we continue to wear those if we've been affected? What about those that have had it?
If you've had the virus, then you're not going to get it again, from what we understand. But I beg you to go onto the CDC website and educate yourself a little bit more on those things, because, like I said, it's a new virus. We may find out later on down the road that this virus actually does replicate and within a year, where like the normal flu virus, it takes about a year, and then you have another phase of that virus. So we have to be careful. You never know. But I believe wearing a mask is going to protect you. It's going to protect the people around you as well. So it's important to wear it. But when you are with your family and you guys are sharing the same space, you don't have to wear a mask inside your house. We got to remember that you can't wear that mask 24/7. You're breathing in your own CO2. So make sure you take breaks from your mask when you're in your car. Don't wear a mask when you're in your car, and don't wear a mask when you're at home.
Yeah, and what about like if you're out exercising, out going for a hike or a walk?
Not necessary at all, because you are 6 feet in between people and you need to be able to breathe in that clean oxygen.
Yeah, you were talking about we heard in the news where some people were having some problems because they were wearing. First responders, nurses, and doctors were having issues, respiratory issues, because of wearing the mask for 12-hour straight, you know, yeah.
And that can be dangerous. We got to be careful with wearing it, but we also need to wear it.
Yeah. So like you said, take the breaks and all that good stuff.
Yeah.
So now you talked about when to go into the ER, making sure you're talking to your doctor, asking those questions. I really like the idea of tracking things, so that when you do speak to your doctor, it's like you
Absolutely.
have the information. That's so crucial, right?
And that's not just for this. That's for everything. If you have a hypertension, you have congestive heart failure, or anything like that, you need to be writing down your daily weights, your daily blood pressures, your daily heart rate, and then bring it into the doctor. Because when you go into the doctor and you have nothing to tell them except what you think you remember, it's not going to be enough, I promise you.
Yeah. So how best should we've decided to go to the ER. How best do we navigate that whole experience?
Well, if the doctor has said, yes, it's time for you to go into the ER, you have a fever, you have 2 or more of the symptoms that have not been going away for a few days, then okay, go into the ER. But when you go into the ER, you need to remember a few things. You need to remember that that person that's going into the ER with you is not going to go past that waiting room. Unfortunately, that is our days. This is the time that we live in, okay? So take your cell phone with you, your cell phone charger. You need to make sure that you have whatever, you know, the doctor's going to need, like a list of your medications, phone numbers of your family, so that we can call them. Because when you're the only person in there and you're not giving us information, or you don't know what medications you're on, etc., it's very difficult. Usually we rely on the family members to help us with those things. But if the family members aren't going to be in there, we definitely need to make sure that you have those things. Cell phones, believe it or not, are a huge thing in there. But you need to social distance in the ER as well. Okay, stay away from the other patients that are in the waiting room. Sit a few seats away from them. Stand back. And they will give you education as you go in. When you walk into the ER, if you do not have a mask, they will give you one. They will check your temperature immediately, and they will have you put alcohol in your hands. So you're protecting yourself and others as you walk into the ER, okay? There's a lot of things that they will educate you on once you go in there, but those are the main things that you need to remember. You will be by yourself after you leave the waiting room. So it's a sad situation sometimes for family members who are in the worst time of their life and they need their family. So that's why we want you to have your phone so you can talk to your family on the phone, FaceTime, so you feel closer to them.
That's a great idea. I never really thought about that.
Yeah.
So that's awesome. So what are some things, you know, as far as any type of resources? I know we've been reviewing things like the multi-state COVID-19 tracker, some things with the CDC. You know, what are some of those things and maybe some others?
Yeah, those are very important to, for you guys to have on your tabs on your computer so you can review them whenever there's a new thing that pops up, because the CDC is the one that is constantly looking things up. I do have a few links that we will put in the underneath the video on YouTube so that you guys can review, but it just explains your symptoms. And if you do test positive for the COVID virus and your doctor doesn't suggest you go into the ER, you still have to social distance for 14 days. You are self-quarantining, not just social distancing. You are staying in your house for 14 days, and you will not step outside that house unless it's absolutely necessary, okay? And then if your symptoms get worse, which they usually get worse around the 8th day, that is when you'll come into the ER, but you need to make sure you have that mask on and everything. So the CDC website has a lot of information about all this. Sometimes you'll have, you know, the taste in your mouth is a little different, or you taste like a little metallic taste, or you can't smell. I mean, those are symptoms as well. So the CDC will give you a lot of symptoms. In fact, here I have some. Fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, congestion or runny nose. here they put nausea, vomiting, and diarrhea, but technically those are not really symptoms of the COVID virus. So they're very, very, very rare. Okay, so keep an eye on those things. What warrants going into the ER is if you have 2 or more of those symptoms, and it's just worse. It's compounding. So trouble breathing, persistent pain that's in the chest, can't take deep breath in, or it hurts when you're taking a deep breath in. Newer confusion. Inability to stay awake, and then number 1 importance, if you start seeing a little bluish tint to your lips, you're not getting enough oxygenation, so you need to get to the ER.
So tell us a little, just real quick, I wanted the viewers to know you had a patient the other day that was told not to cough.
By their family.
Yeah, by their family.
And because they have this, they will say, no, you got a cough in your arm or whatever, no. You need to let it out. You need to cough as loud as you can. This is at home. You need to get that junk from the bottom of your lungs. Pneumonia cannot form if you're getting all the fluid out. If you're making sure you're getting all that bacteria out and you're coughing it out. Sometimes it doesn't work. It's not 100%, but it is definitely something that we teach the patients. Always deep breathe and cough. Okay, you got to get it out.
That's great. Well. We're going to, like she said, we've got some links. There is a really good multi-state link that we're going to put in the description below for you guys. It is a live tracker. It is updated daily. It gives all the states. And there is a really good CDC coronavirus 2019 testing tracker symptoms link that we've been kind of working off, and a couple of others. Remember, it is super important that we stay safe now that we're going to be kind of reopening.
Right.
So this is going to be new. We hope that things get better,
yeah.
But we don't really know. I mean, it's a little scary.
On this, the reopening guide, the state by state, it shows that Arizona, where we live right now, is pretty much opening, but then right next to us, New Mexico is completely closed. California is pretty much closed. So, who knows what's going to happen next? Are we going to, reclose? I don't know for sure. But, it's something that we need to definitely keep an eye on.
Yeah, absolutely.
Yeah. And,
yeah, absolutely. So, all right. Well, this is episode 2. Like we said in our first episode, we're going to have lots of more content coming out. It is going to be driven by not only us and other professionals that Nurse Darlene knows, but you as well. So your comments, things that you may want to talk about, please put those in the comments below. Don't forget to subscribe. Don't forget to click that little bell for the notifications, right? All right, so a lot of wide variety of things that we'll be discussing. So again, we appreciate it, and we'll be talking to you soon. Take care.
Bye-bye.